Hello and welcome to the Community Voice. I'm Fara Sax. Joining me today is Dr. David Manela of Manela Cardiology. He is revolutionizing how we deal with our cardiovascular health. And I want to thank you coming all the way from Aventura.
It's a drive, but a real pleasure to be here.
Did you have to have a passport?
No, but a few highways and a few bridges.
Yeah, very pretty panoramic view of the
Yes,
city.
yes.
So welcome. Thank you so much for coming. And it's beautiful up in Aventura. And your place in Aventura is gorgeous.
Thank you very much.
So your background, let's start, is California, Chicago. Let's keep going back.
It's
and
colored and multifaceted. It's good to have a background from different places. You know, you get different experiences, and I'm proud to say that I grew up in California, Los Angeles, and did a lot of my training in Chicago and then the East Coast. And eventually I've made it here, and it's exciting. But there's a story for each place, and I've learned a lot along the way.
And how long have you been in Florida?
So now it's been roughly 1 year.
Oh, wow.
And I'm proud to say that I've already accustomed to the weather. You know, the weather is not an issue for me.
Really? 110 degrees? He's
Yeah,
doing
no,
really,
it's
really
it's
well.
good. It's good for the heart.
Oh, yeah, perfect. That's a great segue. So talk about like how you became a cardiologist. Why cardiologists? I find sometimes doctors, or often when I speak to doctors, it's a calling. It's really something in their DNA.
Right.
What about in your
So
case?
I will tell you that cardiology and cardiovascular medicine is one of those great fields of medicine that really includes a little bit of everything. There are procedures, interventions, and surgeries that you can get involved with. There's basic physiology that makes sense. There's medications, and that just impact quality of life, but actually extend your longevity. So between medication, physiology, and interventional skill sets, you feel very well-rounded, and you can make a really big impact as a cardiologist.
And what event? I mean, the way you practice cardiology is not like your great grandmother went to a doctor and they evaluated. There was an event that happened in your
Yes.
life that really provoked or really woke you up to that aha moment. I'm going to take my practice in a different route.
I'll tell you, for the most part, becoming a physician, going to medical school, it's pretty much very standard in almost every way. And that's fine, because most of the time when we do metrics on whether or not we're providing good medicine, we do it based on the fact whether or not you can treat the diabetes, whether or not you can treat the hypertension, whether or not patients are getting their screening tests. However, I realize there's so much more than that. I think medicine, for as much as you have to make sure those basics are done, it really still needs to be very personal and custom. And I didn't appreciate that early on. I just thought you got to make sure you treat the diabetes. But it wasn't until my mom became ill. And I know that almost sounds like a cliche, but it isn't. When I went with my mom to the various doctors, it was really the first time in my life where I sat on the other side of the desk. And sometimes I'd have to wait 2-3 hours until the physician came. Sitting on the other side of the desk, you suddenly realized that you didn't actually expect the doctor to come up with this solution or medicine that will cure it all. You just kind of realized if the doctor if he cared, if he really was going to hold my mom's hand during the illness, whether or not there'd be a solution or recovery, I wanted to see if that doctor cared and would hold her hand. And that I realized is lacking. And it was really from that moment that afterwards, when I would see patients, I realized if I'm going to discuss diabetes or hypertension with them, I have to be very, very keen on what they're feeling. They're feeling very, very vulnerable. And it's not just about discussing the state-of-the-art medications. It's also honing into their sensitivities.
And so you took that and you changed your practice.
Changed it. I did most of my medicine at an institution in Los Angeles, Kaiser Permanente. It's a fabulous institution. It's a great hospital. But as with any kind of institutional medicine, you're judged again based on metrics that don't take into account sensitivity, personal customization. So with the story of my mom and realizing what patients need, it was one of the reasons why I decided to leave California, leave gorgeous LA, leave Kaiser, and make the daring move of setting up my own practice here in Miami.
Well, why Miami?
Well,
Could you have done that in California?
So it's a great question, actually. And it turns out not quite.
Otherwise, we wouldn't have had this conversation.
You're right.
We wouldn't be here today.
Los Angeles is very much dominated by institutional medicine. You've got great institutions.
What does that mean? What does that mean, institutional medicine?
Institutional medicine means, hospitals and hospital networks like UCLA, Cedars-Sinai, USC, Kaiser Permanente, they're so dominant and they so determine the character and style of medicine either the hospitals or all their satellite clinical offices, that it's really hard to change the character of medicine when you're going against so many big giants in the field. So as a result, if you get out there and you try to promote something different, you're not going to be heard, you're not going to be noticed when you've got such giants in the same arena. Miami and Florida is a little bit different. Despite the presence of institutions, it's nowhere on the level and magnitude that you would see in Los Angeles and New York. On top of that, because the population is so heterogeneous here, you're never going to be able to win the public with one message. You have so many different cultures here, they each need their own message. And therefore, it's a great opportunity to carve out a niche and bring that message to the various kinds of people. One message will not work for everyone.
So what you've done, we're moving it forward, is you provide cardiovascular help, assistance to your patients through a membership situation, not concierge, not boutique, and it's a beautiful place. It almost looks like a spa. We have a couple of pictures that I'd like for us to talk about. So when you walk in there, you feel like energized, you feel relaxed, you feel like you want to talk a little bit lower and look at this. This is beautiful. So tell me what we're seeing.
That's what we're trying to do. We're trying to make it that as soon as you come into the office, your vulnerabilities are there. You're scared. You may not say it, but you're feeling it. And often doctors' offices are ones in which they're lined by vinyl chairs. There are no windows, and there may be a television playing the same commercial for Medicare Advantage. We wanted it to be where you walk in and you don't need to feel like you're going to come to this doctor's office and talk about things that scare you. We want it to be where you're going to feel excited to see your doctor, engaged. You're going to feel comfortable and welcomed and received in a reception office or a waiting room where, again, if you're not feeling nervous and you're feeling comfortable, you're going to be able to engage your doctor and get to the root of the issue so much better.
So my EKG would probably be better in your office than it would
Yeah,
in the
you're right. To
regular.
know that white coat hypertension and the blood pressure and the heart rate, absolutely. But I'll go one step further. So often when you see a doctor and there is an issue to discuss, after 2 minutes of the discussion, the message is going right over them. It's hard to take it all in at once.
Absolutely. When I showed up, I was so relaxed, and I actually sat maybe not in that chair, but a chair just like that, and I was able to have a conversation with you, and I felt relaxed. I wasn't there to see you as my cardiologist, but I was there to talk to you to find out what you do and how you do it. So tell me a little bit about this particular.
So we designed each of the examination offices very different from what is the standard. Instead of that supine, table where you lay down that crinkly paper and you get an exam and there's just a few chairs and there's a cabinet with nothing in it, we wanted to be very patient-centered in a very comfortable chair, conducive to a really good discussion. Light colors, ample light, sometimes wearing a robe that promotes even more comfort, so that the thrust of the medical care would actually be the discussion. That discussion between doctor and patient is paramount in any kind of intervention or engagement. And that kind of room evokes the ability to talk. Talking for me is, despite the modern interventions and medications we have today, it never supersedes the quality of the discussion.
So this really gives us the opportunity to have a one-on-one in a very comfortable setting where I'm able to really share with you what's going on with maybe my physical health, my emotional health, and where I am spiritually, because it's not just my heart, it's all these other things
everything
that affect who I am.
I'll tell you why that's so relevant. There's a field of medicine or a culture called functional medicine, which has been a little bit controversial because it's a little bit different than the standard, but its premise is based on the notion that medicine has to be individual. Mm-hmm. So understanding a patient's spiritual preference, what their behavioral patterns is, where they excel and where they struggle, clearly is going to impact me as I talk to them about how they can impact their diabetes or high blood pressure. All of that is a lifestyle disease. How do I get to the nitty gritty? How do I understand their individual lifestyle without having that really great discussion? And like you said, in a comfortable setting.
And you would talk about membership. Let's talk about that, because people go, what do you mean? It's a gym membership. There's a membership to the club, but what is a membership to become your patient?
Over the years, I realized that in order to have that great kind of discussion where you open up and get to the nitty gritty and understand who the patient is and how the mechanisms of disease are playing out, you have to get that patient to come back to you many times. There are lots of discussions. There are times where they come for education. There are times where you discuss their medications. The problem is if it's a situation in which they have to come and pay every time they come, that's going to prevent them from coming. If there's a copay every time they come, they're going to realize, no, it's an $80 copay for a specialist. I'll just Google something on WebMD. We want our patients to come into that examination, experience that, but how do they come without worrying what is the cost, what's covered by the insurance, and what's not? Therefore, a membership care model is one in which there's a fixed cost for the year, highly affordable, not very expensive at all. But this way, once you're a member, like any kind of membership, you can come as many times as you want, and the office encourages you to come to be engaged. So the membership takes away the worry about expense and cost and promotes the notion of coming frequently to really engage your health.
And the best part about it is, I know when I've been looking for healthcare is, are you in my network? Are you out of my network? What are my network
Right.
benefits? And how do you address that? And if I needed tests because you're dealing with something in my cardiac situation, how do you address that?
It's a great issue, and it's a very important point that patients bring up a lot in terms of what's covered by insurance, what's not. Today, premiums for health insurance are very expensive. So if you're a patient paying a high monthly premium, you want to get your value from your insurance company. And if it's a membership care model where you pay out of pocket, sometimes that's at odds with what the patient's already paying. What we try to do is to make a very affordable membership care model where it's just a fraction of the cost that you're paying for the doctor, but otherwise everything else is covered by insurance. In a membership care model, we take all insurance. And what that means is after you're seen by us, if there's a diagnostic test, a hospital procedure, or any other kind of intervention, we work with every insurance company. So we'll never tell you, oh, we can't take you because I myself is not on that insurance contract. That never plays into the discussion. It turns out that once I take you, I accept every insurance. So it becomes a hybrid model where for a very affordable price point, you get myself as a physician in my office, but then I work with your insurance company, and therefore we're able to take every insurance because we work with every insurance when it comes to ordering diagnostic tests, labs, and prescriptions. So I think the take-home point is it's really a hybrid model where you can utilize your insurance, but at the same time have freedom of choice to choose a doctor that you want to go to.
And one of the other questions is, well, we're talking membership. Are we talking thousands of dollars? Are we taking $1,000? What does that look like in a year for?
So thank you for asking that because that's a very common question as well. Often when people think about membership, they quickly jump onto that idea of concierge medicine, which is sometimes a membership as well. You're paying a fixed yearly cost to have the privilege of seeing this very special doctor. So we give very much the same custom personal care employed via a membership, but we're anything but privilege and concierge. Whereas often is the case, and it's unfortunate, concierge medicine has become very expensive, anywhere from $4,000 to $6,000. Some even charge $10,000 a year. A membership model that's typically employed is usually at the range of $1,000 to $1,200 for the year. And the reason why there's such a difference, most concierge doctors will tell you, we're going to charge you all this money because you can call me at 3 o'clock in the morning. Well, guess what? No one ever calls their doctor at 3 o'clock in the morning. That's not actually what determines great care. Most of the things that happen in the course of the regular day. So I don't need to sell you a very fancy package for the privilege of calling me at 3 in the morning. Instead, I can sell you a very good personal custom package where you get my quality during the day for a fraction of the price.
And what else comes with that membership?
So membership, like we said, it's frequent engagement, coming to the doctor's office, not just for the choice of screening and prevention tests, not just to calibrate your medications, but being able to come just to discuss education, to spend 30 minutes with your doctor discussing the mechanisms, the etiology, means of controlling diabetes and lifestyle. So because you don't have to pay for these visits and they're encouraged, you're able to come to the doctor and discuss all the various aspects of healthcare, not just one. Membership care also goes out to discuss not just traditional aspects of medicine, but because it's a membership in which we're trying to provide a full body comprehensive approach to medicine, and comprehension or comprehensive is one of the flavors of what membership is, we get to also discuss with you things that aren't traditionally discussed in a doctor's office, and that would include vitamins, antioxidants, exercise, hydration, omega-3 fatty acids, when and how to use them. When often when you see a traditional doctor, he or she may not have that kind of thorough discussion. Whereas in our office, we're going to talk about it. We're going to have a special visit just to talk about it.
And let's talk a little, we're jumping ahead, but let's talk about the vitamins. And do we need vitamins? Do we need supplements? What do we need? How much do we need of it? How would I know if I needed it? And how does that affect my heart health?
Once again, a very relevant discussion. I think every doctor actually needs to be very familiar with the use of vitamins and antioxidants, because there's not a Walgreens or CVS in which there's an aisle stacked with vitamins. And every patient wonders, is this real? Is it true? Can I take it? Does it give me the benefit? Yet I'm being told by my doctor to take medication. So how can a doctor give medication if at the same time they're not having an equal and relevant discussion about vitamins and whether or not there are any alternatives to the traditional medications?
Or can I get the vitamins in the foods that I eat? And,
right.
What's the balance and how do we determine
I think
that?
A really important take-home point is that if you're replete with vitamins because you have a balanced meal and you exercise and you have a very healthy lifestyle, I can very comfortably say that you don't need to supplement with extra vitamins. I think most studies will say that, and most reputable doctors would agree with that if you're a healthy person with a balanced diet, there's no need for supplements.
But that's interesting. Balanced diet. That's like such a misnomer, because how do we know if it's balanced? We're eating well, but
so that's a great question.
Is our gut health really absorbing what needs?
I think a balanced diet would be, if, for instance, the Mediterranean diet, if you're keeping to whole grains, a lot of fish, fruits and vegetables, occasional wine, that's a balanced diet. That's a Mediterranean diet. If you're keeping your waist to hip ratio appropriate and you're not overweight and you're exercising 130 to 150 minutes a week, I would say that's healthy. And in that case, you don't need to do more. But most of us aren't like that. Most of us don't keep the balance. Most of us do not conform to a Mediterranean diet. Most of us succumb to the stresses of life, and we're very inadequate in what we should be doing. In those situations, I think there's great relevance in supplementing with vitamins. Great relevance. And not every vitamin. There are some vitamins that you only need a minuscule amount, and taking extra is not necessary. One of those is vitamin C. People take mega doses of vitamin C.
Well, doesn't it protect me against the cold and
exactly
maybe COVID and maybe
that's what
else?
Everyone says. And it turns out it's a great antioxidant in the setting of disease and early viral illness. And however, but usually after 500 milligrams of taking it, you pee out the rest. So your body can only take so much. But there are other vitamins in which the data is replete that if you supplement with it in cases when you need it, it actually has a profound effect. One of those would be, for example, arginine. Arginine is an amino acid. You can buy it in your local grocery store or even the gas station. It promotes sexual health.
Well, that's very sexy. I can get it at the gas station.
You can even get it at the gas station. And unfortunately, it has a bad reputation because it's sold pretty much anywhere. But the reality is your body converts it to nitric oxide, which is a chemical your body needs. And in many disease states, your body doesn't produce it adequately.
And you were saying that this attributes to some cardiovascular correlation?
It has a tremendous cardiovascular ramifications, because if you're overweight, if you have high cholesterol, if you're sedentary, your body stops producing adequate amounts of nitric oxide. Nitric oxide promotes great coronary blood flow to the brain. Did you know that in people who are elderly, frail, along with having high blood pressure, they show a decline in their cognition? And most people would think there's nothing to do about it. It turns out it's highly dependent on blood flow, and taking arginine, increasing the nitric oxide, actually it helps the dementia. It makes people smarter. It actually, when they do these surveys to assess memory, executive tasks, spatial perception, the scores have shown that after taking something like arginine, they actually do better. And that's proof of a situation when you need it, then it helps.
Interesting. And let's get back to the membership. What else does that include? I know you on Thursdays, you have Secrets to Aging Well. So you have like a lecture series that goes on as well.
So membership, like we talked about, in addition to coming to see your doctor in a very comfortable, conducive manner, a place where you get ample time. It's not just 20 minutes, but easily an hour. In addition to, ancillary healthcare professionals like nutritionists or behavioral therapists who give lectures. We really emphasize lectures and education. We really emphasize that our practice would be a place where you want to come not just to see your doctor, but to see the other important ingredients in the multidisciplinary team. We think health is best delivered when it's not just the doctor. It's not always about the doctor, but it's about the education employed, the other people who provide that. But on top of that, yes, it is education, and the doctors sometimes do great jobs in giving the education. And I'm proud to say that I deliver lectures on Thursday nights at 7:15, all about the secrets to aging well.
And the location is at 2820 Northeast 214th Street, suite number 902 in Aventura.
It's just a great opportunity to learn about health. In a membership in which you can come often and frequently, it's about taking a step back and realizing what are the mistakes that I'm doing. Because we know if you keep on doing the same thing and expect different results,
Insanity.
well, that's just insanity. So, having to rewire ourselves and learn what it is that we're not doing correctly, you can't do that in an annual healthcare visit with your primary care doctor. And especially if you have to teach yourself new tricks, it's going to require frequent visits. It's going to require educational lectures. It's going to require healthcare ancillary staff members who can work with you. It's going to require a great electronic health record where you can communicate with your doctor online. It's going to require lots of different things working together to get you to better health.
And I find that when you go to a doctor, I go to doctors, but they'll give you the pill. But where's this dis-ease coming from?
That's a problem, right?
And I think for you, you're tackling that on a more really real deep level of what's going on in my health, what's going on how do I lead a healthy lifestyle? Like, why would I come to you right after I've had a heart attack? God forbid.
I think it's so important. I think when doctors push pills, but honestly, you can't even blame the doctors. Very often patients expect the pills. Patients want the easy way out, what's convenient.
Because they don't want to work for their health.
And the saddest irony of that is there's a term utilized in medicine today called polypharmacy. We are finding so many patients being on so many medications, and there's a cumulative effect from all the adverse effects, and it's causing its own set of disease. We don't want polypharmacy, but you want to know why multiple pills patients are taking? Why are they on so many pills? Because if the first treatment is here, take a pill, and there's not enough work done on their lifestyle, the pills won't work, and thus you'll have to take a second and third and a fourth pill. Very often in the treatment of high blood pressure, people are on 4 to 5 different medications. And if the doctor or staff would spend a little bit more time with that patient and realize that they're having just a bagels, lox, and cream cheese sandwich a little bit too often, and they're really sneaking in the salt,
I like
that would make a big difference.
But the patient has to want to get better, want to have their health renewed. Sometimes I think take a pill. You don't have to deal with what's going on.
I think
it takes a lot of responsibility.
Right.
So it's a two-way street.
It may get back to the whole concept of wanting to come see a doctor. If we reimagine medicine or a practice, a place where it's like a spa, it's like a gym membership, it's a fun place to come, then maybe the patient won't resort to a pill. You know why they take a pill? Because they don't want to see the doctor again. Give me a pill that does an amazing job, and this way I just have to see you once a year. If a patient chose not to take the pill, they would have to engage their doctor a little bit more frequently, because going the lifestyle intervention route takes more time and more follow-up with the doctor. But if that doctor's office is playing the same Medicare Advantage commercial on the television and there are no windows in the waiting room, they don't want to come to that office. So we're hoping that if we make coming to see your doctor a beautiful, inviting, warm place, then maybe patients will change their perspective and want to engage their lifestyle better.
And when I was there, I felt like I didn't want to leave. But let's get back to why would I come see you? What's going on in my life? Do you see people after they've had heart attacks, if they have AFib? Let's talk about what your patients look like.
Yeah, so that's a great point. I'll tell you right now, the status quo is that patients or primary care doctors often will not send patients to a cardiologist until an event has happened, until they've suffered heart failure, until they already have a full-blown arrhythmia, until they've had the heart attack, or until they're having symptoms leading up to the heart attack. And at that point, so much has already happened. It's stressful, it's tension filled, the patient's already very nervous. And at that point, you can't really have a discussion about lifestyle. It's all about intervention. And maybe to that extent is why people think of cardiologists all about intervention. But I think the way you're supposed to come see a cardiologist, it doesn't have to be all about acute intervention. It could be prevention. I think if people were to see a cardiologist much earlier in the natural history of their disease, perhaps when they're first diagnosed with hypertension, so that the cardiologist could explain to them why are they developing hypertension and what are all the cardiovascular ramifications that can ensue from hypertension if it's not well treated, and what are the things we can look for early on during the preclinical phase so that the later stages don't develop. Wow, what an opportunity to make an impact. And that very often cannot be easily conveyed by an internist. That's where you want the specialist. Bring in the specialist to do a better job in education. That concept is revolutionary. Right now, we bring in specialists for the acute intervention, for the
Absolutely.
tertiary treatment of the disease. We don't seem to bring in specialists for the education and the prevention. And that's where we're different. We're encouraging patients to come to see us for primary prevention. Coming, if the internist will make the diagnosis of high blood pressure, send them over to the cardiovascular specialist. Let the cardiovascular specialist do a very in-depth assessment and teaching and in hopes of preventing any of the sequelae that can usually happen with hypertension, because when that happens, it's already very difficult to then change things.
I know, and you make you make go for great lengths to differentiate between the primary care doctor versus an internist versus a specialist internist. So how do you know which doctor
So-
to see when, and can we do this in like an orchestra well executed
How to
together?
orchestrate it.
Yeah.
In my humble opinion, I think there's always a very important role for a primary care doctor. Primary care doctors, they're the overseers, they're the general contractors, they're the gatekeepers in a way in which they have to kind of keep everything balanced. They have to look at the internal medicine, which are the issues inside the heart, the kidneys, the liver, the brain. They also have to look at the mental wellness of someone. They have to look at how the disease interact with each other. But even more importantly, they have to make sure to screen and prevent disease. They're the first people exposed to a person's early illness. They're the ones that do triage on some level. Now, it's a little bit daring for me to say that a primary care doctor does triage. It almost seems to demote them to the level of a nurse. It's not true. It's a sophisticated position to properly triage and identify the early forms of illness. That, I think, is such a beautiful role that a primary care doctor has. But once those early forms of illness are identified, it's a very sophisticated task to get into it at that point and find ways to prevent it from getting worse. That's where I think bringing in an internist slash specialist who has just a plethora of skill sets and experience. People think that early in the natural history of illness, you don't need to do much. It's my humble opinion. That's when you need to do everything. You've got to be even more aggressive early on because there's so much you can do, quite frankly, when it comes to lifestyle illness. The extent to which you can do and make an impact, I think you want to bring on a specialist to really make that to make that effect. I think the primary care doctor will work towards identifying it, but then bring in that internist specialist who can really formulate the strategy to prevent the illness from going any further.
And how much do you think is hereditary? How much do you think is environmental? How much is
Fabulous question.
in lifestyle?
It's a great question because
It's $1 million question, right?
I'll give you one condition that reflects that just perfectly is diabetes. Diabetes is genetic. But at the same time, we know that if we become overweight and eat the wrong things, we bring on diabetes. So there's no question most medical conditions are a balance of both. But we tend to call it the two-hit hypothesis. You may have a genetic predisposition, but you need the other hit. You have one hit is the genetics, but if you don't give your body the other hit and you're able to change the lifestyle, then you can actually really prevent the illness from developing. Or if it develops in only a very mild form. But that gets back to the point. there's such an art to the prevention of disease, and it has to be underscored better than it currently is.
And why did you choose? I keep going back to that. Why did you choose membership? Why did you choose a membership model? And
So,
where does that come
so,
from, even?
so things have changed over the years,
Really?
because medicine has been very insurance based, and there's been a lot of grief over the way insurance handles your healthcare.
Is it serving us well?
It's a great question. Insurance, like institutions, do a great job when it comes to population medicine. They'll be very good in screening for diabetes. They'll be very good in screening for hypertension. But they'll be just as good in, once identified, here's the medication you need to take. They'll be very good in saying, yes, we have a nutritionist that you can use 5 miles away at these hours only. Try to figure it out and give them a call. And meanwhile, when you call, you can never get through. They'll provide certain ancillary care services, but the ability to get it and when you can get it and on your terms, very hard to do. But meanwhile, they've done a great job in identifying the diabetes and giving you the medication. But when it gets to the personal customization of healthcare, which ultimately everyone's disease manifests a little bit differently, that's where traditional insurance-based or network hospital-driven medicine does a lousy job. And that's where membership care, where it encourages you to come to the doctor's office frequently, have ancillary healthcare professionals who are there working within the membership, working with you. I think that kind of system can give you the more personal custom care that, especially if we want to prevent disease and get to the root of the issue, that model will be more effective.
And one of the things that you do offer is an IV infusion. What are these infusions?
It's very popular.
It's like thrown around. I can have a cocktail or I can have an IV, everything
Right.
in a bag or in a glass. Well, what is that about?
So IV infusions, well, if you think about it, it started off with the notion that, getting back to vitamins do play a certain role. And we don't have to go so far as to when you're just under the weather. When you're under the weather, your body has to be even more vigorous to fight the viral infection. We know that antibiotics are not the cure for an upper respiratory infection. Your body's health has to be at a perfect level to fight the viral infection correctly. And as we get older, and again, from a lack of a balanced diet to lack of exercise, we don't have the appropriate amount of antioxidants in our system. Maybe we're not producing nitric oxide correctly. And then when it comes to illness, for instance, we're lacking. So the data for sure shows that vitamins like vitamin C are effective. But the problem is, often when certain vitamins and certain conditions have proven to be effective, when you take them orally, your GI system just breaks it down. The bioavailability of vitamins often is very poor. So for as much as the theory of vitamin supplementation works when your body needs it, it's the delivery of the vitamin that's lacking.
So in other words, if your gut health is not proper, it
If
might
your
not be able to
gut
absorb
health, or just simply the role of the liver, first pass metabolism, it's hard to get the vitamin in your system. We have known, I want to give you an example of a vitamin that for the longest amount of time, the American College of Cardiology and the American Heart Association had pushed, but doctors never really believed in it until we realized we weren't giving enough of it. And that's omega-3 fatty acid. We never saw really great data, but yet these organizations talked about, and the realization was that in those people who need it, you need to give 4 grams of a purified derivative of omega-3 called EPA. Now, for the longest amount of time, we were never giving that kind of dose because the bioavailability is poor, and that's why you have to give 4 grams. It makes the point that bioavailability may be the limiting reason why oral vitamins are just not that effective. And thus the idea of giving these things IV, where you bypass the liver, you bypass the digestive enzymes, and thus in someone who needs the vitamin, giving it IV may actually prove to be effective. But you need to go to a place where they know what they're doing. Even placement of an IV is not benign. Infection, phlebitis concedens, so it has to be done under appropriate conditions.
And you do that through blood work. You find out what the vitamin need is.
So that's a great point. There are certain vitamins, and vitamins is a catch-all term for everything, but if we were to kind of break it into its parts, there's one category of vitamins called antioxidants, which have proven to be very effective.
ACES?
AC. Oh, vitamin A, C, E. Yes, vitamin A, vitamin C, vitamin E, but
Selenium.
selenium. But it turns out that in some of the studies, it showed that if you take too much vitamin E, it leads to death. Too much of antioxidants actually can have an untoward effect because it's a healthy balance. If you take too much antioxidants and you don't need it, the body takes that antioxidant and causes a reverse effect.
Isn't that
So
amazing?
it's amazing. So in the body, everything is balanced, and sometimes too much of a good thing can be bad. And we saw that with vitamin E. We saw that with vitamin E. We know with vitamin C, you can't even get to that level. Thus, you really need a skilled doctor to identify if you have a deficiency in that antioxidant, if you need it relative to what your disease states are, go get a blood level, create the reason, create the picture for why you think you may need it or why there's a relative deficiency. And once that's established, then go give it. Now, with glutathione, for instance, which is the most powerful antioxidant in the body, the reason why you don't hear too much about it is because it cannot be delivered through the GI system. There's no pill for glutathione. The only way to deliver glutathione is if you either have it as a liposome where you put it under the tongue and let it just naturally absorb within the blood vessels of your mouth, or if you take it intranasally. But the delivery of that is very unpredictable. So it's hard to give glutathione, even though it's such a powerful antioxidant and has a proven effect in the course of age and disease. That's a great example where IV infusion of glutathione would prove to be very effective, again, in cases when you need it.
And under the supervision of a doctor.
Absolutely.
So in the time we have left, tell our audience maybe a couple of things that we haven't covered today or that you want to tell us about.
I like to share with
cardiology.
everyone, when you see your doctor, I think it's really important to have a personal relationship, be able to relate to him and vice versa, either he or her. It should be a mutual relationship where each of you understand each other. You're going to discuss sensitive things. You may want to have mutual things that you enjoy to talk about. It's a discussion, a conversation, and a relationship that should last for years. So I try to do that because my skill sets are not just medicine based. I enjoy reading. I enjoy religion and Talmud. I speak at various organizations and I collect experiences along the way. I make every effort when I engage patients to have that great discussion, to get to know them, to discuss every aspect of life, because believe it or not, it's every aspect of life that has relevance to health. And I think if we look at things from that perspective, then whether it's a doctor or whether anyone else that's going to be involved in your health, they're going to have a much better impact on you if they're working with you from that very overall far-reaching effect.
It's the best I could have ever wanted, is what you just said, and I really appreciate that. And you're a gentleman and a wonderful man, and I love the office, and I love you, the way that you think, and I appreciate you being here with us and sharing everything that there is to know. And if you would like to reach Dr. Manela, his office is located in Aventura at 786-320-5633, or on his website at manelacardiology.com. And I appreciate you being here with us and sharing the wealth of information. And it's only the beginning of many good things. And welcome to Aventura and beyond.
Thank you. You're so kind. My pleasure. Thank you.
And thank you for joining us today on The Community Voice. I'm Fara Sax.